So it's a very extremely broad question. That's the point.
Well, we're gonna cover CNS tox with the Blina and the CAR-T, and VOD with inotuzumab, and of course, the asparaginase complications. Shall we pick these three topics, Andre?
Maybe I fully agree. There was a question by our host about diagnostic procedures, which I do not fully understand. Do we have to improve the weight of the diagnostic procedures for these patients in terms of supportive care? Probably there is a big difference between the pediatric field and the adult field in terms of how do you reduce the load of pain, of anxiousness, etc., etc. But I'm not sure about what I'm saying. So, do we cover diagnostic procedure, Elias, or do we forget this?
But I see
Okay.
Dr. Stock had a question for us. Wendy, you wanna
Yeah,
take?
no, I was just wondering, in terms of supportive care, I think just the definition of supportive care is a broad one.
Yeah,
And I was just
exactly.
wondering whether you were also referring to sort of the specialized care that's required in terms of the expertise and the network of people who support these patients as they go through treatment. Because I think for ALL, it's quite unique, and the pediatric world is very used to that because that's what they do, but the adult world hasn't been so used to it. So I'm just wondering if that's part of this discussion, because I think that's an equally important part of, if not more important than the actual drugs that we use and the actual quote unquote supportive care drugs like, ursodiol or what have you. So I just was wondering if that was part of this.
Thank you, Wendy, for bringing this issue. I think it's an extremely interesting one. The network approach, let's say, which should be the rule for the care of this type of patients, whatever the network inside the hospital or outside the hospital, and probably Europe, US, and inside Europe and inside US, there are very different realities about this inside network and outside networks. But how could we cover these potential first item in terms of what is necessary or what do we would like to recommend? Would you like to make some opinion about that? So what is your answer? And then we will give the floor to Oliver.
What is my answer? Is that what you're asking?
Yeah, yeah.
Oh, well, yeah, I think it would be, I mean, it's a huge topic of discussion, but, I think these specialized centers for care, trying to define what an important team would be is important, since most of this treatment is actually, at least in the US, given as an outpatient. In at least the young adult population, and increasingly in the older adult population, where we're moving away from intensive chemotherapy. But I just think it's a very interesting and important question. I don't know, it's not as easily definable as, what prophylaxis you use, etc. But I think it's extraordinarily important. I don't know how everybody else feels, at least in the adult world. I think it's sort of a no-brainer in the pediatric world in some ways.
So, no, but you have moved from the idea that networking inside and outside hospital is absolutely key, and specialized team like let's say leukemia teams are absolutely key. And you have moved slowly to the topic of the future is outpatient. How do we deal with this? Am I
Yes.
right or wrong? My
Yes. No.
interpretation of what you said.
Yes. You're correct. I don't know if that's what you were intending, but that's what I was thinking when I saw the supportive care in the title.
Yeah, I was also thinking a little bit more along the lines of quality of life and, socioeconomic and whatever social care. Here in Wales, we have huge geographic and socioeconomic challenges to treating these patients. So there's been a lot of emphasis on actually collecting the data from the patients on what for them constitutes, quality of life issues and the most or those issues that have the greatest impact on them. So it might not be what was intended, but I do think that this is an aspect that would deserve some study. It's difficult, and but I agree with Wendy. I think this should be addressed in some form or other.
So how could we address this issue of the two issues that Wendy raised? One again is the specialized centers plus networking inside and outside, and the modern trend for outpatient treatment. How could we address for the hub this question? Written recommendation.
Yeah, it's very hard, but I think the discussion about how best to manage this disease is an important one, not just in terms of all of the things that we can very easily define, but that these are big questions. And as Oliver said, the whole sort of symptom burden management and long-term survivorship care and all of those things are all very crucial and I think incredibly important, since we're hopefully curing the majority of these patients now. I'm done. I'm sorry.
André, you mentioned that you don't become an AI expert within a week or two or a month or 2 months, correct? And what Wendy has been leading in USA, the Alliance Group, is networking and get people on board to learn more about and work together. This will help promoting great supportive care and great management for ELL, because writing recommendations and send them to people to apply may not be very helpful.
No, I fully agree. I'm not in favor of that.
André, maybe it's not relevant, but one issue that has recently emerged in the pediatric community is that it's certainly more enough to present the outcome data according to overall survival or event-free survival, but basically by defining strictly the toxicity in ALL, try to include as well in the outcome data these parameters, which is something very new for us because we are not definitely used to do, except of course event which imply death or relapse, and accordingly designing Kaplan-Meier curve. But this is very important, and this Kills-Migeloff report recently outlines something that I don't know, but at least for the pediatric setting, is becoming exactly for what Wendy said, because we do have the toxicity burden during treatment, and of course impact in long-term survivorship. And this is something very relevant. And having an agreement on that is something, at least in the pediatric community, an important step forward.
It's true that we discussed this issue since very long time, and Kild and others have pushed the concept of toxicity-free, event-free survival, which is probably an important issue to measure the burden. So the first point is, how do you define the main toxicity that you would like to count as an event in the curve, which makes your curve drop? And the group have made a lot of efforts for this. And I do think that there should be some kind of communication between the adult and the pediatric world. And maybe it is the interest of this hub to try to see if you would agree also to say, for example, that if someone is brought to heart transplant, this is an event. And if someone is paraplegic after ALL treatment, this is an event, and so on. So they are what is called unacceptable toxicity, which makes your event-free survival curve drop. So let's call this stringent EFS, if you want to be simpler.
Yeah, I think I think that's an excellent point. As we move forward and cure more and more patients, young adults and even older adults, these are, and especially the children who have long lives ahead of them, the symptom burden and the long-term toxicities are still huge. And I think those are incredibly important. But how to address exactly, I'm not sure. I think education is an important one, and understanding what those burdens are. Oliver mentioned, some patient-related symptom burden surveys and psychological distress surveys that have all been published, but need to be more out there potentially and more acted upon.
Perhaps an event that defines the toxicity could be the event that makes the suppression of a specific therapy. So I think it's an objective event, for example, a neurological event, seizures in a patient who receives blinatumomab, for example, no, or VOD in a patient who receives inotuzumab, or major thromboembolic event in a patient with asparaginase, no. I think that objective things that make that have prompted to suppression of a specific therapy. It could be an event, and it's easily defined for anybody, for any person.
Okay, so finally, this topic of supportive care has generated a lot of interest, which does not surprise me. But we do not have definite answer for our colleagues of the ALL Hub. But I think that we have raised here 2 or 3 items which are important to be followed by further discussions, but exchange between the pediatric and adult world is probably of utmost importance in that line.